Thank you. Good morning, everyone. How are you? I'm Katie Towns, and I'm so thankful to be here today. I am an assistant director at the Springfield-Greene County Health Department, and I think a lot of times when the health department is in the room, people wonder why we're here. So it's for good reasons today, and I really like the opportunity to be able to talk about good things that are going on in our community. So to give you a little bit of background on who I am and why I'm here and why I do what I do, I thought I would sort of start with the story about how I got to Springfield and how I got into this role. I love my job. I love Springfield. I grew up in St. Louis and came here for college and kind of always thought I would leave and go back home to St. Louis. And I did for a little while, but I quickly realized that I had fallen in love with the people in this community, and I came back and pursued my master's here, and was connected with one of my instructors was my former boss, and he hired me after I got done with my master's, and I started working at the health department. And although I never thought I would work in government, I will tell you the opportunities that I have been afforded have been endless, and to be able to be a part of something that is truly an improving sort of agency, I'm humbled and I'm privileged every day to go to work and do what I do with the team that we have. But I'll tell you a little bit more to give you a reason as to why I'm here talking about improving community health and why it's so important to me. When I came to school here, I was a freshman in the Woods dorm over there on Monroe Street. And at the end of my freshman year of college, I found a lump in my breast. And long story short, at 18 years old, I was diagnosed with a very rare form of breast cancer. And about 10 years later, it came back. And they didn't know what to do with me because I was very young, and it was such a rare form that they decided that the best thing possible was to pursue a preventative mastectomy and to allow me and afford me the chance to go on with my life without having to worry about as much as I would had I not. And so at that time, I kind of quickly was thrown into understanding what not being in control of your health means and how that can affect you. And also sort of recognizing that there were a lot of things that I could do to improve my health and to take care of myself. And so I decided that at that time that was really something that I wanted to be a focus and a part of my life. And fast forward into the career that I have sort of wound up in, I think it was somewhat coincidental. But also fortuitous in the fact that I have learned so much about how there are a lot of factors that we can actually influence regarding our individual health, but also our community health that are not related to things that are uncontrolled and that just happen to us in life. And so that has really become a mission of our department. And we do show up when people don't necessarily want us to be there for things that are not fun to talk about, like outbreaks and some of those situations. But our department has really taken a step into trying to find out ways that we can help with improving our overall community. And that is through health. But the great thing about health is that there are a lot of factors that sort of also play into health. So to kind of get us started, I'd like you to think about what health means to you. And I'm sure that there are a lot of things that come to mind when you think about what health is for you and for your family and what that means for you as you go about your daily activities. And maybe it means what you're thinking about what you had for breakfast or what you didn't have for breakfast and you're hungry, or maybe you're thinking about how taking your kids to the doctor on a regular basis is a part of making health a priority in your life. But there's all these different things that play into what your health is and how that sort of translates into your life. And so I've been told that I'm going to have some slides here that would pull up. But I want to focus for a minute, too, on the fact that I have 2 kids, that one is 7 and one is 6, and my little girl, Marin, there she is on the right. And if you go to the next slide, I want to show you that face, because that's her face that I get quite a bit lately. And it's often coupled with the statement, "It's not fair." And so I've been trying to figure out how to respond to that statement on a regular basis. And recently, what I've talked to her about is, what are you going to do about that? What are you going to do about the fact that it's not fair? Because we all know, and I was told many times as a child, life is not fair. And so I've been responding with that. And I'd like to challenge each of you to think about, what are you going to do about this? What are you going to do about your health? What are you going to do about your community's health? And think about how we can all respond in that way to the statement that it's not fair. Because life and health are not fair. And as you think about things that you can do to improve your community, you can find that there are opportunities where it's not fair that we can have a chance to affect things. In public health, what we do a lot of times is advocate for the community as our patient. And it sort of is a departure from what you might think about in terms of health and your individual health. What we look at is how we can overall protect the community and improve the safety and the livelihood of the people who live and work and play in our community. And I think many times that lets us think about things like, does our community have a rate that is higher than average of smoking or of exercise habits or eating healthy? And those are all behaviors that definitely contribute to our health. But there's things that we can also do and look at that are more oriented towards the bigger picture. And there are things like systems and policies that may be set up and structurally give us an advantage towards making us healthier, or they can help put us at a disadvantage. And at our department, what we've been doing is trying to take a look at the layers and the factors that underlie some of those systems and policies that will help us improve the way that people can make health an easier choice, make it an easier behavior than something that's not quite as healthy. So there's a video that I'd like to show you that it's the next slide, actually. And this helps us describe a little bit more about what those factors are that we look at in community health, and the fact that there might be some things that aren't quite fair about how our community is structurally set up. So I'll let that play. And then
what determines how long we'll live? Is it what we do? Is it who we are? Actually, when it comes to predicting how long you'll live, your zip code is more important than your genetic code. Here's how this works. Meet Deb and Maria. They both have jobs, they're around the same age, they're both married, and they both have 2 kids. Deb lives in A-Town, while Maria lives in B-ville, less than 1 mile away. They're similar in so many ways, but here's the thing. On average, residents of B-ville will die more than 15 years sooner than the residents of A-Town. Why? Because where you live is about more than just your address. It's about your opportunities. For example, Deb and Maria's access to healthy options is really different. In A-Town, Deb's family is surrounded by healthy food options, including farmers markets, specialty shops, and grocery stores. The air in A-Town is cleaner and fresher, and there are lots of safe, clean parks where Deb can exercise and her children can play. A-Town has good public schools for Deb's kids and easy access to emergency and preventive health care. On the other hand, Beeville has broken, badly lit sidewalks, and the parks are unsafe. The air is filled with truck exhausts from the nearby highway. And for food options, Maria's only choices are Beeville's many liquor stores, fast food places, or convenience stores. The schools in Beeville are overcrowded and undersupported. And even if Maria can get her kids into better schools far away, she needs to figure out how to get them there without access to a car. So for Maria, having to juggle so much to find healthy options can be an overwhelming source of chronic stress, which is a serious health risk factor. In fact, for all the residents of Beeville, chronic stress drives health problems like obesity, diabetes, asthma, and heart disease. How did A-Town and Beeville get so different? Well, in many cases in cities and towns across California, the root cause was racial and economic discrimination. Over the generations, poor white people and people of color were pushed to less desirable parts of town. Where banks refused to lend money, businesses left, jobs too, schools declined, and the neighborhood crumbled. Everyone who could move away did. And what's more, when communities like A-Town and Beeville are so unequal, Beeville isn't the only one that suffers. Because it turns out that not only is your zip code a predictor of how long you'll live, so is what country you live in. Countries with the greatest income inequality have the lowest life expectancy. So even Americans like Deb, who are white, insured, college-educated, and upper income, die younger than their peers in other countries. In fact, our life expectancy is 43rd in the world, and that number is slipping. In the end, our biggest health risk may actually be inequality, and extreme inequality hurts us all. So what do we do? Well, if we're all going to be healthier, we don't just need to help the folks in Beeville beat the odds. We need to change the odds for everyone. And that's what we're doing. There's a movement happening. We're Californians. We don't follow. We lead. We are building the power to make health happen in communities across the state. We are coming together to build one California, a smarter, more inclusive and equitable state that creates health and opportunity for all of us. Join us. To learn more, visit buildinghealthycommunities.org.
So obviously we're not Californians, but we are Springfieldians, and I'm extremely thankful that there are organizations like Schweitzer and others that are looking for opportunities like this to create a better Springfield. And what I would challenge you with is to look for the inequity and look for where it is unfair, and then find ways that you can make it better. There's things you can do individually. There's things that we can do communally. And one of the things that I will leave you with is one of our most recent studies that we've conducted has given us a deep dive into understanding a little bit more about the mental health and substance abuse issue in our community. And it's a great heavy weight on our community right now. There's a lot of really good things that are happening to improve access so that people can have treatment for mental health and substance abuse, but it's something that we continue to struggle with. And as we researched this issue, we found that in our community, people are dying by suicide at a greater rate than people in our state and people in our country. And so we have some work to do here. We have work in order to, probably the number one way that we all can be a part of the solution is to look for ways to decrease stigma, to allow people to talk and to be transparent with their mental illness and their struggles, and to accept them where they are when they need the help. We wouldn't tell our kids if they came to us with a broken leg that we needed them to try harder or to give it a little bit more time. We would tell them that immediately we were going to find a way to get them the help that they need. And so if you're not familiar with the signs and symptoms of mental illness and substance abuse, become familiar. There's a wonderful class that Community Partnership of the Ozarks offers called Mental Health First Aid. And this is a starting point for you to become educated and be a part of decreasing that stigma and getting people the help that they need. And I'd be glad to help connect you with that at any time. But I sincerely thank you for taking the time today to be a part of the solution and for allowing me the chance to come and talk a little bit about the work that we're doing.
All right, so I'm back on stage, which means it is question time. The world is unfair. What are you going to do about it? Those are fighting words, if ever I've heard them.
So I really liked that video, but I was kind of surprised that it also didn't mention adverse childhood experiences as a risk factor for, heart disease or health issues later on in life and then premature death. So how locally is the health department looking into ACEs and how ACE scores will impact physical and mental health?
That's an excellent question. So ACE scores are a relatively, it's not a new concept, but it's something that has been a part of dialogue in our community more recently. And what it is that there were some very smart people who took a look at adverse childhood experiences or trauma in people's lives as a predictor of their health as they become adults. And they found that there were very strong correlations between trauma as in childhood and then how healthy or unhealthy a person would be as an adult. And what we did when we conducted our mental health assessment, we talked a lot about that, and we asked the providers, the hospitals in our community, if they were using these ACE scores and the research behind that to intervene when they treated patients. And it's starting. I think what I can say is that we have found that people are using and are creating that dialogue. There's a lot of primary care now being coupled with mental and behavioral health care, which is a huge start. I think in our structure of medicine over the course of the several decades of our health history, we've separated the mental from the physical. And we're starting to understand how to better incorporate mental and physical health. And that's been a part of it. So they're using some of the ACE screenings inside treatment facilities now. And that will really help us to understand the root cause of some of the physical manifestations that people are having due to mental health issues. So more to come. But yeah, it's a great set of research. And if you haven't become familiar, I encourage you to understand that. It's fascinating.
Hello. Can you tell us, is it 5 different qualifying factors of the ACEs that are pointed out, like sexual abuse as a child? What are those? Can you name them?
I am not a mental health expert, so
okay.
I don't use them on a daily basis. I don't practice in a treatment setting per se, so I can't name them off the top of my head. But
okay.
I know that they are things like physical trauma, sexual trauma, mental trauma, and there are different components and layers within that. I'm sure maybe you would be able to.
Domestic violence, divorce. Okay. I was just asking that because I know in the programs that I am a part of here, most of the people going through my programs actually have all 5 of them. So it's definitely a contribute. 10 of them. Okay. So I know it's definitely a huge contributing factor.
It is a huge contributor. And I think, what they're also finding is that most people have experienced some sort of trauma in their life. And so we all have those things. And I think that's an important factor to consider, too, when you think about people seeking the help that they need with regards to their own mental wellness. But to sort of level set that. And then also to point back to the fact that some people are going to have a much greater risk of needing treatment or assistance with their mental wellness at some point in life. And so just that receptivity to understanding, and I think that to switch the dialogue, a lot of what people are using to inform or understand the situation is to have the conversation about what happened to you rather than what's wrong with you when somebody presents and they're in a crisis situation. So that just sort of changes the dialogue and resets, so it's not a person coming seeking help and then having somebody react with oh, there must be something wrong. It's not wrong, it's just what happened. So that's been a really key factor in helping us learn how to approach situations.
At one time, several years ago, some communities around the U.S. were looking at exercise being more widely available and making that be a part of kind of community organizing. And what they were doing at the time was to take the rights of way for utilities, electric, water, gas. And we have one citywide, really good utility system here in Springfield. Do you know if the city of Springfield or anybody has thought about bike trails on all those rights of ways? That could eliminate that inequality right there, just free access.
Sure. That issue of active transportation has become a huge topic of conversation because we do have transportation disparity in our community. And yes, so I know I was even a part of, it was several years ago now, but we received some funding from the CDC that we were actually able to designate some bike trails or bike paths along the roadways. But I think more of the community conversation is centering around the fact of connecting greenways trails and allowing those to be used for active transport and for transport across our community. And I think that is a place where I would encourage, if anybody has that interest in becoming a part of that, funding for those connections of those trails is always sort of something that we struggle with. And so we continue to look for that, but also the concept of educating our community about the fact that people riding bikes should be treated the same way as a car or a pedestrian or anything else. We have a long way to go in that regard. My brother lives in Madison, Wisconsin, and they use their bikes to go everywhere. But I think one of the things that we face in our community is that there's a safety issue that people sort of that prevents them from using active transportation. So it's twofold. It's trying to increase that, but also being aware of the practical standpoint of where we are in our community. So very good question. And yes, there's lots of good work going on in that arena.
Katie, thank you so much for your time.
Thank you.
It was good.